I'm Cristina Howorun outside of Credit Valley Hospital, just steps away from where an ophthalmologist secretary allegedly accessed hundreds of personal and private files without authorization. We're talking about medical files here. That's emergency visits, pharmaceutical report, mental health care logs. She had access to the files of every single person who had ever walked through a Trillium Healthcare Partners doors. In one case, she actually allegedly accessed one person's file over 150 times.
I received a letter originally in June of this year saying that my records had been breached 40 times. I received a letter on Thursday now, and it has now changed to 159 times.
It may have been a case of sibling rivalry at the start, but Katie is now part of a $3 million class action lawsuit, which names her estranged sister, the hospital, and the ophthalmologist her sister used to work for as defendants.
In this case, it appears that Trillium allowed someone who was not even employed by the hospital, who was a secretary of another doctor, to have unfettered access to all of its records on all of its patients for many, many, many years. There have got to be many other people in the same position.
That's because access to this patient portal isn't just afforded to Trillium staff, but also 1,300 doctors and their employees, meaning your personal information is just a few unprotected keystrokes away for thousands of people.
We've asked the hospital how many people, how many patients, current or former, are affected, and they won't tell us. It's the most important question of all, I think, to everyone who walks in their door, but they won't say.
We asked the hospital the same question repeatedly. They didn't respond. Instead, saying THP regularly conducts audits, and we've recently increased the frequency of audits. Further, THP has a new audit system that will proactively detect when personal health records have been accessed improperly. Once Trillium was aware that the defendant may have been accessing files inappropriately, it suspended her access to the portal. But Trillium and other large community hospitals were recently cited by the Auditor General for not always doing a great job of protecting patients' information. Criminal record checks weren't always being performed on employees. Former employees continued to retain their access to computer systems, and automatic logouts weren't always used for computers with patient information. In a statement of defense, Lyons says the plaintiff provided consent to access her medical records several years ago, and that the plaintiff never withdrew the consent. Katie says that's not the case and says the whole ordeal has left her feeling
Violated. Incredibly violated.
We attempted to reach Lisa Lyons several times today, but she could not be reached for comment. In Mississauga, Cristina Howorun, City News.